The first question is, what is the primary function of the heart? Let's take a look at the options. A. Digestion. B. Pumping blood. C. Filtering blood. Or D. Producing hormones. Time's up. The right answer is B. Pumping blood. Next question is, which chamber of the heart pumps oxygenated blood to the body? Let's take a look at the options. A. Right atrium. B. Left atrium. C. Right ventricle. Or D. Left ventricle. Time's up. The right answer is D. Left ventricle. Next question is, what is the name of the valve between the left atrium and the left ventricle? Let's take a look at the options. A. Tricuspid valve. B. Pulmonary valve. C. Mitral valve. Or D. Aortic valve. Time's up. The right answer is C. Mitral valve. Next question is, which artery carries oxygenated blood from the heart to the body? Let's take a look at the options. A. Pulmonary artery. B. Coronary artery. C. Aorta. Or D. Carotid artery. Time's up. The right answer is C. Aorta. Next question is, what is the average resting heart rate for an adult? Let's take a look at the options. A. 40 to 60 beats per minute. B. 60 to 100 beats per minute. C. 100 to 120 beats per minute. Or D. 120 to 140 beats per minute. Time's up. The right answer is B. 60 to 100 beats per minute. Next question is, what is the outermost layer of the heart called? Let's take a look at the options. A. Myocardium. B. Endocardium. C. Pericardium. Or D. Epicardium. Time's up. The right answer is C. Pericardium. Next question is, what is the name of the pacemaker of the heart? Let's take a look at the options. A. AV node. B. SA node. C. Bundle of His. Or D. Purkinje fibers. Time's up. The right answer is B. SA node. Next question is, which type of blood vessel carries blood back to the heart? Let's take a look at the options. A. Arteries. B. Capillaries. C. Veins. Or D. Arterioles. Time's up. The right answer is C. Veins. Next question is, what is the condition called when the heart's blood supply is blocked? Let's take a look at the options. A. Stroke. B. Aneurysm. C. Myocardial infarction. Or D. Angina. Time's up. The right answer is C. Myocardial infarction. Next question is, what is the primary muscle tissue of the heart called? Let's take a look at the options. A. Skeletal muscle. B. Cardiac muscle. C. Smooth muscle. Or D. Connective tissue. Time's up. The right answer is B. Cardiac muscle. Next question is, what is the condition of high blood pressure called? Let's take a look at the options. A. hypotension, B. hypertension, C. tachycardia, or D. bradycardia. Time's up. The right answer is B. hypertension. Next question is, which part of the heart receives deoxygenated blood from the body? Let's take a look at the options. A. Right atrium. B. Left atrium. C. Right ventricle. Or D. Left ventricle. Time's up. The right answer is A. Right atrium. Next question is, what does ECG stand for in cardiology? Let's take a look at the options. A. Electrocardiogram. B. Echocardiogram. C. Electromyogram. Or D. Electroencephalogram. Time's up. The right answer is A. Electrocardiogram. Next question is, what is the primary function of the coronary arteries? Let's take a look at the options. A. Supply blood to the lungs. B. Supply blood to the brain. C. Supply blood to the heart muscle. Or D. Supply blood to the kidneys. Time's up. The right answer is C. Supply blood to the heart muscle. Next question is, what is the term for an abnormally fast heart rate? Let's take a look at the options. A. Bradycardia. B. Tachycardia. C. Arrhythmia. Or D. Fibrillation. Time's up. The right answer is B. Tachycardia. Next question is, which of the following is not a risk factor for heart disease? Let's take a look at the options. A. Smoking. B. High cholesterol. C. Regular exercise. Or D. High blood pressure. Time's up. The right answer is C. Regular exercise. Next question is, what is the sac-like structure that surrounds the heart? Let's take a look at the options. A. Peritoneum. B. Pleura. C. Pericardium. Or D. Meninges. Time's up. The right answer is C. Pericardium. Next question is, which heart chamber is responsible for pumping blood to the lungs? Let's take a look at the options. A. Left atrium. B. Right atrium. C. Left ventricle. Or D. Right ventricle. Time's up. The right answer is D. Right ventricle. Next question is, which valve prevents the backflow of blood into the right atrium? Let's take a look at the options. A. Mitral valve. B. Tricuspid valve. C. Aortic valve. Or D. Pulmonary valve. Time's up. The right answer is B. Tricuspid valve. Next question is, what is the term for the death of heart muscle due to lack of blood supply? Let's take a look at the options. A. Angina. B. Myocarditis. C. Myocardial infarction. Or D. Endocarditis. Time's up. The right answer is C. Myocardial infarction.